has done a great deal to improve things. But in a 4-part house probe, Kennernhofer reports that some ambulance attendants at Urgence Santé say their skills are not being used properly.
It was with great fanfare more than 2 years ago that the Levesque government unveiled Urgence Santé, a publicly run ambulance and mobile doctor service. It has already answered 500,000 calls in Montreal. But Quebec acted late. More than 10 years before, hundreds of American cities began setting up paramedic systems. They used the medical experience of the Vietnam War to train ambulance, fire department, and other emergency crews to stabilize the afflicted at the scene of a problem. TV shows such as Emergency popularized the paramedics' work.
We've defibrillated ×2. He's still in cardiac arrest.
51, continue CPR. Start an IV with D5W, 2 amp sodium bicarb.
And they provided a stark contrast with the vacuum in mobile emergency care that existed in Montreal. Paramedical courses were offered at Dawson College in the 70s, but emergency medicine was ragtag. The police maintained a swoop and scoop service with officers who knew little more than first aid. Private ambulance companies started such unregulated paramedic systems as Resuscicar, and private dial-a-doctor services, sensing a goldmine of profit, competed on the road.
I think you need a system. What we have now is a hodgepodge.
The catalyst was the death of the financially troubled telemedic doctor service. The government took over the service under Urgence Santé, with private ambulance companies participating under contract. Some European countries have doctors on the road. In North America, it's an innovation, but it allowed the government to cut into the surplus of physicians here and claim that the quality of emergency care offered is potentially better than anywhere else.
Trends throughout North America tend to prove that paramedics are good, but if you have doctors, it's a better level of quality of services.
At peak periods, 18 doctors' cars are on the road, along with more than 60 ambulances, through Montreal Island and Laval. Nurses take emergency calls and determine what kind of care is needed, depending on the patient's condition. And dispatchers then assign ambulances or doctors or both to the trouble spot. Ambulance response times, once way over 10 minutes in many cases, have been cut to an average of 4 minutes. And within 4 minutes more, doctors are generally on the scene. And that meets standards of the American Heart Association. Though criticized in the beginning for being unqualified, 80% of the service's 187 MDs now have completed advanced cardiac life support training. It's obligatory for new doctors signing on. Some ambulance attendants complain that some doctors still don't perform well, and Urgence Santé says that only a handful of complaints are made about doctors' care each year. But the doctors admit that the transition wasn't easy.
I know there's at least 2 or 3 who have just been expelled. There's been a few who have been suspended pending further education. The criteria to work at Urgence Santé now are stricter than most and as strict as any emergency room in Quebec.
Despite the obvious good that Urgence Santé has done, a debate is raging internally over the role of the service's ambulance attendants. And they say the debate is important because the public's health and safety is involved. They say that $5 million in doctors' salaries per year, or $320 per shift, is too expensive, and that paramedics would be cheaper. The head of Quebec's Professional Corporation of Physicians defends our so-called Cadillac system.
And maybe it is more expensive, but also it's more secure because you can give a diagnosis.
A group of Montreal ambulance attendants, people who claim to have advanced paramedical training, also argue that on some occasions, doctors arrive at accident scenes late. But even these highly trained ambulance attendants say they're little more than stretcher bearers, allowed to do only basic first aid and cardiopulmonary resuscitation.
Anything that is not considered an invasive maneuver, we're not allowed to put anything into the body. We're not allowed to start an intravenous, for example. We're not allowed to administer drugs. The paramedic has the ability to do more, and yet that care, the advanced care, is still waiting for the doctor to arrive, which may be 5 minutes later or more.
The law requires that senior ambulance attendants have 120 hours of training, though Urgence Santé requires double that. And Urgence Santé doctors say that training always needs to be improved.
We need, in order to work with the doctor at the scene of an accident or at the scene of a cardiac arrest, 3 highly qualified people, as qualified as the people we work with in the hospitals.
Dr. Peter Cohen founded Dawson College's now-defunct program, and he estimates that there are only 6 or 7 such people among the 600 Urgence Santé ambulance attendants. But Gary McHugh says the number is closer to 30.
And McHugh's group, the Emergency Medical Technicians Association of Quebec, charges that while their care is urgently needed, there's a quagmire of contradictory laws and double standards. And caught in the middle is the patient's right to the best care possible. More tomorrow. Kernhofer Pulse Probe.
Technically forbidden in Quebec, but in the second of a 4-part pulse probe, Kernhofer reports that Urgence Santé's policy allows ambulance attendants to perform medical procedures under a doctor's orders.
Across North America, paramedics give people in distress emergency care on the road. In the early 70s, Dr. Peter Cohen started to teach paramedic skills at Dawson College. Cohen says that as the remote hands, eyes, and ears of doctors, paramedics are acceptable, unless you have mobile doctors.
We did not foresee the possibility that we would ever have doctors on the road. And therefore, we had to create an extension of the doctor's capabilities outside the hospital.
A paramedic program got the support of a committee of doctors in this report several years ago to the Professional Corporation of Doctors. But Quebec dropped the idea when it took over the failing dial-a-doctor services in Montreal more than 2 years ago. The resulting Urgence Santé system is similar to some European models, and Cohen now believes that it's potentially the best mobile emergency system in North America.
In North America, we think that we can take anyone with grade 11 and give him 500 hours training, and that he then would be a paramedic and be able to do all those things that in France they think only a trained anesthetist can do. And this just does not make sense.
That turnabout in opinion has made Cohen a bit of a turncoat in the view of some of his former students. People like Gary McHugh, president of the Emergency Medical Technicians Association of Quebec. McHugh proudly says that diplomas like this from the federally regulated National Registry in the United States allow him to do advanced medical acts in many places in the U.S. But when his ambulance arrives at the scene of a mishap in Montreal, he's only allowed to do basic life support and CPR, and either transport to hospital or wait for the doctor.
I call it the hands tied syndrome. I've often thought of myself in that situation as a lifeguard who's standing at the side of the pool where someone is drowning, and I have a life preserver in my hands, but I'm not allowed to throw it.
They don't have any legal existence, and they don't have any authorization to do any medical acts.
That brutal statement by Augustin Roy, head of the Doctors Professional Corporation, describes the paramedics' predicament in a nutshell. Nowhere in Quebec's medical law can doctors delegate advanced medical procedures to paramedics, as they can do to nurses. And the theory at Urgence Santé is that doctors arrive in plenty of time to handle problems themselves. But Abraham Perlmutter, the co-owner of 5 ambulance companies, follows a slightly different policy. He cited religious reasons for not allowing us to show his face.
The policy in my company, which I have most of the paramedics, is very tight. Absolutely no medical acts unless given permission by a doctor on the phone or the doctor is on the scene.
And that describes the first in what some ambulance attendants say is a series of contradictions. Although not recognized by any law, on the road, on certain rare occasions, they say that doctors sometimes allow them to perform medical acts.
I've done it myself, where I was 100% sure of the person I talked to.
I definitely would. I definitely do. If I know who's at the end of the phone, you know, if I know the guys and I've trained them, I've been part of their training and I know what they can do.
Even Urgence Santé's director, Bernard Lefebvre, says there's nothing wrong with the procedure.
We stretched that fact before, and it's a team effort to try and save someone, and it's the doctors who has the leadership of the team when they get on the scene of something.
The procedure isn't always successful. Dr. Cohen illustrates by telling how he gave into an ambulance attendant's pressure over the phone and allowed him to set an intravenous line. The attempt failed after repeated tries.
This is totally ridiculous, doesn't serve any purpose, and is just for the joy of sticking needles into people. And there are quite a few who just like doing that. And these people have to be controlled. They are dangerous.
Nevertheless, it still happens, though rarely. In fact, the only time these informal medical acts will not occur is when an ambulance attendant and doctor don't know each other.
Many of the doctors would be hesitant to designate acts. Because we're not a recognized profession, there really is very little control. Some of the paramedics have called and we've begged for orders, and we've been told, no, stick to basics, your job is to transport.
A further complication is that Urgence Santé doctors and dispatchers don't have lists naming any of the highly trained attendants. McHugh's group says there are 30 of them, but Cohen contends that that's inflated because 6 or 7 completed the original 1,500-hour Dawson College program, while others took a less intensive course.
But the situation doesn't end there. Some paramedics say that on certain rare occasions, they've actually given advanced care without a doctor's direct supervision. They say that while one law appears to forbid it, another law actually requires it. More tomorrow. Ken Ernhofer, Pulse Probe.
There was more violence. They could work as paramedics anywhere in North America. Anywhere, that is, but here. But in the third installment of a 4-part Pulse Probe, Ken Ernhofer reports that contradictory laws are forcing some attendants to take people's lives into their own hands.
Yesterday, we showed that at most 30 ambulance attendants in Montreal say they have advanced paramedical training. And though the law does not explicitly allow them to perform medical acts, some Urgence Santé doctors sometimes ask them or grant them permission anyway.
Jennifer, they're going to start an IV on you.
This ambulance crew, working without a doctor, just warned this hypoglycemic patient that they might start an intravenous line, but they didn't have to. Urgence Santé policy forbids them from doing it, especially when a doctor isn't there to take responsibility. But some ambulance attendants say that when they're alone on rare critical cases, they must decide by themselves whether to go beyond basic life support and CPR. Steve Wilkinson is accredited to work as a paramedic in New York, but he says he lost his job on an Urgence Santé ambulance last year after treating a woman with severe asthma.
I started an intravenous line and administered oxygen. En route to the hospital, I administered adrenaline, standard dose for an asthmatic patient.
Urgence Santé officials refused to talk about the case directly, but a doctor who examined the charts says Wilkinson was wrong.
Steve did a very, very stupid thing. He gave a medication to a patient that, as it turns out after, was not warranted.
Wilkinson counters that the doctor who filed the complaint could not have known the gravity of the patient's condition before she received the medication. Another attendant, Gary McHugh, says he used advanced procedures while he was off duty recently to treat his dying grandmother. While on duty another time, he arrived on the scene of a heart attack ahead of the doctor.
The activity on the monitor defibrillator said that the patient was in coarse ventricular fibrillation, and I took it upon myself to defibrillate that patient right away. And that was done. The doctor arrived a few minutes later, and the doctor said, okay, very good, let's continue.
What we were using was the way the law is written. It's very gray as far as emergency care. And we were doing what we thought was necessary for the patient's welfare.
Although Quebec's medical and health laws do not recognize paramedics, ambulance attendants say they're protected by this, Canada's Criminal Code. Certain clauses make it a crime to omit to do something causing death. Other sections allow anyone to do reasonably performed emergency surgery.
You have not only the right, but the obligation to give help to that patient, to that person, and nobody will ever prosecute you or even dare to prosecute you. I mean, we could sue these people for illegal practice of medicine, but we would look stupid.
The procedure also leaves open the possibility of lawsuits. Urgence Santé says that attendants go to such extremes only rarely, and when Urgence Santé finds out, it files complaints with the ambulance company that employs them. Nevertheless, Urgence Santé's stand seems uncertain.
I say gray zones because you have to use your own judgment in situation, but as I said before, you cannot invoke one law to say that this law tells me to do what is best to do, and do things that another law defends you to do.
Wilkinson now works part-time in Côte St. Luc on an emergency municipal unit that assists the Urgence Santé ambulances.
If I can save a patient's life by doing something, I'll do it. Basically, in Quebec, it's got to come down to one day having it tested in court.
Wilkinson says that after his case, Urgence Santé ordered all the drugs off the ambulances. But Gary McHugh says that his drug case is always nearby, even though his employer denies any knowledge of that. And this crew had its paramedic case ready. Urgence Santé says this is against the rules, but says Director Lefebvre, if they have it, they can't use it. But if they supply the doctor, it's okay. Some of the doctors believe there's a way around the legal problems and double standards. Dr. Peter Cohen, a member of Urgence Santé's medical committee, calls some ambulance attendants dangerous cowboys who just want to shoot drugs. But he says that ambulance training must be continuously upgraded. He says that he's prepared to push for tests and on-the-road evaluations by doctors to determine which attendants should be allowed to perform medical acts under medical supervision.
Yes, I am willing to support the idea that they will start IVs and that they will do certain other procedures that are necessary.
Pain was radiating out left arm.
Such a step might require Urgence Santé to start using radio telemetry equipment, which would feed information on a patient's condition from the scene, or written protocols outlining exactly which treatments are allowed under which circumstances outside of a doctor's presence. Urgence Santé says the possibility is open.
If anybody comes out, especially the doctors, saying that the formation of the ambulance attendant is now upgraded enough that we can look into something else, we'll do it with the doctors, but I think the say belongs to them.
The potential here in Montreal to integrate paramedics into Urgence Santé as it is now with the doctors on the road would give us probably a system unparalleled.
In the meantime, ambulance attendance courses are underway at a Huntsic college. Course administrators plan to offer advanced courses for paramedic candidates, and ambulance company officials hope that with new, more highly qualified attendants being trained, pressure will build to allow paramedics to put their skills to work.
Officials of the Doctors' Professional Order warned that the government must approve any changes, and representatives of the ambulance attendants worry that the doctors' proposals may just be empty goodwill. Nevertheless, Gary McHugh did meet with a committee of doctors here at Urgence Santé's headquarters within the last week. The only thing now is for someone to take a first step. Tomorrow, a look at some of the dispatching problems at Urgence Santé. Ken Ernhofer, Pulse Probe.
The system is the dispatching network. Ken Ernhofer looks at some of the problems in the final installment of his Pulse Probe report.
Urgence Santé's call dispatching room is the nerve center of the 2-year-old emergency service. Most times it handles things well, dispatching doctors and ambulances thousands of times to emergencies of all sorts. But not always. Doctors argued recently that call screening or triage is sometimes cumbersome and some important calls not properly assigned. Last month, the family of a dead Laval woman launched a lawsuit claiming that though she had had a heart attack, an Urgence Santé doctor never came, even though an ambulance was sent. There also seems to be some problems in the coordination with police. The island-wide police force once had 39 ambulances. Now there are only 8. The force is complying with Quebec law, which allows only an Urgence Santé ambulance system here. Nevertheless, police switchboards are still flooded with 1,000 ambulance calls a month.
It's 1,000 calls that are not, that should not be sent here. We are tying the lines and in the meantime, we are not available for real emergencies that concern the police.
Most callers here are told to dial Urgence Santé at 842-4242. Unclear callers who don't specifically ask for an ambulance get a patrol car, and panicky callers are supposed to be transferred directly to an Urgence Santé line.
But it doesn't always work. One example of that happened 6 weeks ago at this Curb Street apartment building when a Greek immigrant named Andreas Kalabis had a heart attack. It was a case where everything seemed to go wrong.
The 63-year-old man and his wife Panayota had been babysitting their grandchildren. Kalabis began to sweat profusely, clutched his chest and fell. As he lay next to a bed on the floor, his wife screamed, alerting neighbors.
She was panicking very much as well. So what I did, called the police and I said, I think the man is dead. It's dying.
A police car was sent under radio orders specifying a gravely ill person, but Litsakis took a precaution, phoned wife Maria, and asked her to get an ambulance. She phoned Urgence Santé and spoke to a nurse.
But she wanted too much information I didn't have.
You weren't even here?
No, I was in my office 50 miles across town. And to be honest with you, I got into an argument with her.
The nurse did not send an ambulance immediately. She waited 4 minutes until a policeman called from the scene. The ambulance arrived at least 12 minutes after the initial call, 3 times longer than usual. Kalabis died on the way to hospital.
If they could arrive earlier, they could save him. She hopes maybe they could save him, but they came too late.
It's very unusual, as far as I'm concerned, that the police would get a call for somebody sick into a house, or they would send a patrol car and call us after. I think it would be an isolated case.
The police refuse to talk about individual cases. They say they get many false alarms, and they blame the public for not speaking clearly and for calling the wrong agency.
If a citizen calls here and he says that he wants the police, we will send the police.
Urgence Santé also appeared to break its own policy to send ambulances immediately, where a caller cannot give full details.
I think we've got to be notified so we get back to the nurses and look into the particular case.
We know of 2 other cases within a week of the Kalabis incident where patrol cars answered traffic or other calls where a medical emergency was also happening. They later called Urgence Santé for help. Although only a few minutes were lost, they can be crucial, especially in cardiac cases. Police and ambulance officials believe that situations like this are more representative. A man called police when a woman suffered a bad fall. The call was immediately transferred to Urgence Santé, and police arrived later. Police and ambulance officials meet regularly. They insist that all the problems should be ironed out with a 911 emergency phone system, though that's still at least 2 years away. On the West Island, there's another concern, the great distances that ambulances must cover. So in Point Claire, Beaconsfield, Dollard, Kirkland, Côte St. Luc, and Westmount, an innovative supplement has been created. The first responders. Trained municipal employees, usually firemen or public security agents, maintain a radio link with Urgence Santé and are dispatched to calls in their territory at the same time as ambulances.
So if an ambulance is stationed at a lower point of our city, it will take him maybe 6 minutes to get there, where a fire truck is located at a station will arrive in 3 minutes. We stabilize or maintain the patient until the arrival of the ambulance, and when the ambulance arrives, then we assist them if they require our assistance.
I figure it's an excellent way of utilizing fire service to provide an additional service for the general public.
Other municipalities, especially in the East Island, are watching the first responder programs closely. Urgence Santé officials say they are useful, but not always necessary. Solutions like the first responder fall into the category of fine-tuning. In fact, everything that Urgence Santé is going through now can be considered fine-tuning. So it's useful to remember how much better off we are now than we were even a few short years ago, because at least now we have a mechanism for solving the problems of emergency care on the road. The big question now is, when will the rest of Quebec catch up? Ken Ernhofer, Pulse Pro.
Especially more training about drugs. That follows a coroner's report that says the technicians should take pharmacology courses. But as Sheila Kinch reports, it's not just Urgence Santé that says the technicians are undertrained.
Urgence Santé ambulance technicians receive 180 hours of training. They learn how to stabilize a patient and how to transport that patient to hospital. They are not trained or allowed to prepare drugs, but they often do. In the cases of emergency, it is sometimes done.
It's sometimes done, yes, for the patient.
It was done last March to a prisoner who died at the Parthenay Detention Center. He was being treated for convulsions by Urgence Santé. According to a coroner's report, one of the factors leading to his death is that he was given the wrong drug, a drug prepared by the ambulance technician. Dr. Michel Tétrault is an emergency specialist. He agrees that technicians often prepare drugs, but he says it's up to the physician to check the drug before giving it to the patient. Unfortunately, he says, it's not always done.
And that once in a while, through difficulties with human communication, the wrong drug might be given to the wrong patient.
Nellie Saunders says she often prepares drugs for doctors. She's an ambulance technician at Urgence Santé. She's also president of the Quebec Association of Emergency Medical Technicians. Saunders admits that the ambulance technicians do not have the training to prepare drugs. But she says they're undertrained in most areas.
I would not feel good about calling an ambulance. And I'm not speaking just for myself. I can tell you that a lot of ambulance technicians feel the same way. You just are not guaranteed good care. You're entitled to it, but you're not guaranteed it.
Urgence Santé is trying to get more training for the technicians. It's asked the government to approve a college-level course, one that would begin this fall. Sheila Kinch, CBC News, Montreal.
Medical help didn't reach them fast enough. In other parts of Canada and the U.S., trained paramedics can save lives before patients get to the hospital. Here in Quebec, there are trained paramedics, but it's illegal for them to practice their profession. Katie Malik has this special report.
If you need emergency care in a hurry, good luck. An ambulance will come to your door, but there's no guarantee that there will be a doctor aboard. And ambulance technicians can't do much except give you oxygen and get you to the hospital. By then, you may be dead. In fact, experts say up to 30,000 Canadians die each year in situations like this. The irony is that in Quebec, there are some people on those ambulances who could save your life, but they're not legally allowed to. They're paramedics. Paramedics save lives because they are able to perform emergency medical functions at the scene of an accident or a heart attack or a fire. They're not doctors, but they do work on a doctor's orders. That means that they could pull you out of a burning car. They could perform an emergency tracheotomy if you were choking to death. They can even stimulate your heart with very special equipment. The problem is that paramedics aren't legally recognized in the province of Quebec. Here, only a doctor is supposed to perform those functions. What that means is that our emergency medical care system works fine if a doctor makes it fast to the scene of each and every medical emergency.
You didn't have a medical checkup very recently? No. Okay, what we're going to do is, first of all, just try to make it a little more comfortable. Just try and sit back a bit. That's it, sir.
But Barry Tottle can tell you that doesn't always happen. Barry's a fireman with the Pointe Claire Fire Department. He remembers getting the emergency call when his own father had a fatal heart attack.
The ambulance, and when I arrived, nothing was being done before I arrived. The unit that was at the scene at that time was not an ambulance, it was a police vehicle, and the officers were doing the best they could. But at that day, I decided that something had to be done to change the situation.
This morning, what we're going to do is we're going to review our cardiac arrest protocol. What we should do.
So Barry went back to school to get training as a paramedic. He's part of a paramedic program at the fire station, which puts him in a funny legal bind. It means he's equipped with advanced medical skills, which by law, he's not allowed to use.
I feel, one, frustrated, and two, I look at the patient who is lying in front of me and say, if you only lived somewhere else, I'd be able to do something for you.
Paramedics are illegal only in Quebec and New Brunswick. Across the rest of Canada, paramedic programs are either in place or in the works. In fact, in Calgary, every ambulance has at least one trained paramedic on board. Sandra Clark is executive director of the ACT Foundation. ACT stands for Advanced Coronary Treatment. Her group has compiled some sobering figures.
Over 2,800 people died at home, on the street, in the pre-hospital phase. If Montreal had the CPR response and paramedic response of Seattle and other developed systems, that would mean saving over 800 Montreal lives each year.
So first thing I would do is position his head properly. Place my mask on, make sure 3 fingers are under the mandible.
But being outside Quebec law hasn't stopped paramedics like Barry. They know that in a life-or-death situation, they'll use their expertise if it means saving someone. So Barry's continuing to get further training in a course at the Lakeshore General Hospital. Because paramedics have no legal status, even just teaching the course has become a touchy issue. Only after months of debate did hospital administrators agree to let the course be given. Dr. Jacques Nadeau is head of emergency at the Lakeshore. He says that in emergencies, especially heart attacks, every moment is crucial. And he says that the system as it's set up now just isn't equipped to handle that fact.